realizing that just kind of eased a lot of my anxiety, because I was just like going back and forth. Should I go to grad school right away? But the fact that I was able to kind of learn a lot from the internship that I had, and it what was like 8 weeks-ish. And I just like put myself in like a year from now, and I was like, yeah, I think a job is what's right for me. Being able to kind of gain that hands-on, but also understanding how to work on a team. That was a major thing. Like even virtually working at the internship, there was a lot of challenging moments, right? Having a virtual intern is not easy, but navigating that and being able to advocate for myself, that was an important piece. And that's some of the concerns that I shared with our mentors, and they kind of helped me, ease my worry, but also kind of be more realistic with what I'm capable of, reassurance. But also just like hearing that other students have the same concerns and fears and anxiety, like all these things, all these feelings that we're feeling, like it felt like we were in it together.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 69. Hi everyone, Omari Richards here. Welcome to another student edition of the podcast. Be sure that you subscribe, that you like, that you share this with a friend, that you leave a review. And if you want to support, you can go to buymeacoffee.com/the Millennial. Also follow me on Instagram at the Millennial. I really enjoyed today's conversation. This person I know very deeply and I work with her a lot. And I know that you all are going to get a lot of value from her story. She's doing amazing things as an undergraduate public health student in her senior year. And I got value from this. You're going to get value from this. Listen to her insights and her tips and apply them, and you are going to be doing some great stuff. Enjoy. Today, we have an aspiring public health professional who is problem-inspired, people-driven, and equity-minded. She's determined to serve underprivileged communities to alleviate systemic inequities, racial injustices, and tackle the social determinants of health. She strongly believes that access to quality healthcare should not be a privilege, and she strives to develop a culturally sensitive and robust solutions that advance health equity in all the work that she does. Growing up an Ethiopian immigrant in a low-income community, she has witnessed numerous medical emergencies and conditions that were preventable. Even among those who seek care, culturally competent and patient-centered care is not accessible. This past summer, she has had the honor of becoming a CDC CUPS Scholar with the University of Michigan Future Public Health Program, or FPHLP, and program intern with the Henry Ford Health Systems, where she developed an online resource hub focused on creating a comprehensive directory of employee lactation spaces within the health system. As she enters into her senior year of undergraduate studies at Franklin and Marshall College, she looks forward to engaging with the community as a peer health educator and a first-year advising mentor. As a trained birth doula, she also looks forward to exploring her passions for maternal and child health. Today, we have Hermela Assefa. Welcome to the show.
Hi, Omari. Thank you so much for having me. Really excited that we finally are able to talk and share some of the insight that I have and just also learn from you.
Yeah. I am. I think more excited to share about your story and everything that you're doing in public health, because you are amazing. First of all, I'll just put that out there right there and then. But yeah, I really love all the things that you're doing and the proactive nature of yourself.
Thank you.
Yeah, you're most welcome. So tell us a little bit about yourself and what are your preferred pronouns?
Yeah, I think you said a lot of it, but I was born in Ethiopia and I grew up in the States. I came up just at the age of 2 with my family. And I'm from the DC, Maryland, Virginia area. I now go to school at Franklin and Marshall College, located in Lancaster, Pennsylvania. So just roughly 2.5 hours away from home, not too far, but not too close. My preferred pronouns are she, her. And just as you shared, public health is my passion, my newfound journey, the career path that I'm on. And that I'm exploring, have some experiences here and there that I'm trying to like boil down because it's such a broad field. But I mean, through the lessons that I'm learning, I'm really enjoying the field so far, and I can't wait to see what comes in the future.
Yeah, absolutely. And you're positioning yourself to do a lot of great things. And I think that a lot of people can learn from you, both undergraduate and master level students can learn from your proactive nature. So how did you like what tell me about the thought process of you going into undergrad, first of all?
So yeah, I didn't also share that I'm a senior in undergrad, so just about to finish. I chose, I guess, like I can kind of talk about how I chose my school. It I applied to like 18 schools because I'm a very indecisive person. I just wanted to explore things. A lot of my schools were similar in the fact that like I knew I wanted a liberal arts kind of small school, private school. Why I chose that route is because like they give a lot of money, and also the one thing that I was scared about is the fact that they were predominantly white institutions. I went to a high school that was very diverse, and then having to integrate myself in a new kind of community, that was a challenge that I wanted to take on because I thought that would allow me to grow in many different ways, and it has with like a lot of Black and brown students on predominantly white institutions. And so this wasn't my first choice, but because they gave me a lot of money, but also my family lives out here. So I thought it was the best of both worlds. I could kind of have a home away from home and have that comfort, but also like be in a place that's like it has like a community focus at my school. And that's something that's really important to me personally. And so I chose the school, and it's been an uphill battle. There's some good things, bad things. Obviously, being a minority at an institution, there's a lot of inequities that are present, but I think it's been a worthwhile experience, and I am happy with my choice now that I'm here and that I'm about to graduate in May.
Almost there to the finish line,
Yeah.
So I hope that persevere. And you mentioned that like in high school you were in a very diverse atmosphere environment, and like now in university you had to transition to a more predominantly white institution with more people. What was that transition like for you?
Yeah, I think the classroom is where I felt it a lot in my first year. That was kind of an adjustment, I would say. Luckily for me, I found my people before kind of coming on campus in a way. I did an overnight program April or May before I committed. So I committed in May, did it in April, and I met like some of my closest friends till this day at like during that program. It was centered around minority students. And so I highly recommend for anyone listening, like do those types of programs that are meant to kind of like build your pathway to the campus that you're about to enter. Even if you don't choose the school, it kind of will give you that experience. And I think that was a pivotal thing for me, like I said. And so I also did a pre-orientation program. So I got to move in like a week and a half-ish early, which again, I met a new set of friends that were, I would say, like diverse in a way, not just like culturally, but also kind of like in the ways they think, where they grew up. Like I said, I'm from Northern Virginia specifically, and a lot of people that I met from like New York, Philadelphia, just like New Jersey was a big one. So learning how they grew up was, I think, another adjustment that I had to get used to compared to like how I grew up and the way they think. So it was like I think it wasn't a terrible experience, but I think as I went on, I start to feel it more as I got into like upper level classes and things like that.
Okay, and it sounds like you definitely put yourself out there, or bit like as I was saying earlier, just being proactive and like making sure that you are taking up those initiatives to make a community and feel more at home and get all those things like beforehand. So I think that's admirable as well, and that's something that other people could definitely take advice and insights from you. So I don't think I said, but you are a public health major.
Yeah.
Did you go into school? Like how did you learn about public health? Did you go into school as a public health major? Tell me about that process.
The answer is no. I didn't know what public health was. I mean, I think that's a very common thing for a lot of public health people. So I grew up thinking I wanted to become a pediatrician. I think that's also a very common thing, wanting to become a doctor and then transitioning once you find out what public health is. So I had that vision, thought I was going to go to med school, and like that was my vision. But then something hit me. I don't know. The summer before I started college, I was just like, I don't know. Like, I don't want to set my mind to something that's like, that I wasn't sure about at the time, but also I just had this gut feeling that it wasn't for me. Not that I was trying to set limitations because it was hard or because, it's kind of a difficult path. I also am a first generation college student. That's another addition to my identity that I think kind of shapes my experiences in college. And so I kind of stumbled across public health after taking an intro to public health class. I was just like, let me take it. It seems interesting. And at my school, it's at Franklin Marshall, we have public health on like the bio track and also the government track. And they just made a sociology track. And so as I was taking more classes, the professor, like it is a small department. So like, it's not really, a lot of people that I know are doing the public health major more and more, but it's a growing department. Took the classes, loved the professors, loved kind of the preventative and community-based focus that public health had. And that's what I wanted to do. I didn't have the language at the time, but public health was more what I wanted instead of pre-med, because that's more one-on-one, but it's not that population level impact. And so that's kind of how I chose it. It's why I'm here. And I'm also a public health major on the sociology track. So it's more social focused in terms of what I learned.
Okay, that's awesome. I was going to make a comment saying that's really cool that there's a public health track with sociology, because I feel like the two of them are very intertwined and you get a lot of more like perspectives of populations that from sociology than you do get from public health, and you get to understand that a little bit better. I always think the public health sociology combination is always a great way to start.
Yeah, exactly.
Yeah, well, why did you choose that track?
I took Social 100 my freshman year. I really love my Professor Rondini. And so she just like learning about like culture and identity and like racism and all that. I just thought that was integral to like what I was studying, right? Like that when we're talking about populations and the thing, like everything behind that, that's sociology. And I think that's really important. But other than that, I took a government 100 class, didn't like that. Policy is not my like major thing that I'm interested in. Bio, I had to take chem and I was like, no, that's one of the reasons why I didn't want pre-med. I took the like general classes. So we all have to take those general classes and then we kind of like specialize. So when that track was built, I was like, that's the one for me because I had already taken some social classes.
Yeah, and I think that's a great way to think of it. It's the same way like about people thinking about what they want to do in public health. You said that you got a little bit of experience in this class and you're like, oh, this isn't for me, or this is something that I like more, and really choosing the track from things that you've experienced and going from there. I think that's a really good way to think about it and to go about doing it. So
Yeah.
before I ask you about the CDC CUPS Scholar with the University of Michigan Future Public Health Leaders Program, I know that you're, yeah, it is quite a mouthful. I wanted to ask you, because I know that you work with Habesha Health. So first, you can share what Habesha Health is and like what kind of work do you do with them?
Yeah, so Habesha Health is a virtual health platform that's geared towards addressing the health disparities in the Ethiopian and Eritrean diaspora. So mainly focused in the US, but I mean, the knowledge transcends globally. And it's, similar to a lot of other immigrant backgrounds and cultures. We hold monthly, I guess, health webinars focused on different topics, and it's usually like a conversational based kind of community discussion, and it's an Ethiopian and Eritrean health professional that leads the conversation. So we've had one on breast cancer, Alzheimer's disease. We just had one on pregnancy, mental health. So we're trying to break down some stigma, address the taboo topics. We're also kind of like in the future thinking about like the community. We have a community health needs assessment and just gathering data because there's not much out there. And what kind of powers what we do is, again, it's community driven, and we're trying to educate. That's at the forefront of our agenda. And kind of like backstory on how I got involved, I think it adds another like lesson that I learned is like I got this opportunity by networking with an alumni from FNM. Like it was an Ethiopian alumni that I'd seen in our like directory, and I was like, wait, I didn't know we had other like Habesha alumni. And so when I reached out to her on LinkedIn, I just sent her a quick message and like we talked, and she's like, actually, there's this opportunity, there's this thing I'm involved in. And then I joined the team, and it's kind of been history ever since. I've had a lot of great experiences with that, and I've learned a lot kind of how to manage like a health platform. And it's been here for a while, but like the virtual side of it was just launched about a year ago. So that's a little bit about what we do.
Okay, yeah, that's awesome. And yeah, thank you for the background. I definitely think it is insightful, especially for other students to hear that you went through the school directory and you just saw someone that you could relate to and you reached out to, and then you got this opportunity, which you still continue to work with them to this day. And then, and like to that entire point, I feel like you've been able to get a lot of skills and do get experiences out of this that are very valuable for your public health career, especially like community health needs assessments and understanding that there are gaps around that and those kinds of things as well.
Yeah, I definitely try to strategize any way that I can. I'm like, one thing that I did was like I turned like kind of my work with Habesha Health into an internship for credit at school. And so like I love the work that I was doing. So I was like, let me just turn it into a credit. That worked out for me. And again, it's like added a layer of like I did social media management, website management. So like these skills that I didn't expect to learn, that's one thing. I think I try to be innovative in the things that I do and like strategize. Like if like there's one thing in front of me, like how can I connect it to something else that I'm doing in order to kind of minimize or like just do it in a smart way instead of working harder. So that's one other lesson I would add.
Yeah, absolutely. Tell me more about how you advocated to get an internship credit from this.
Yeah, so our school does like internship for credits are a thing, and you can do it like a semester during the summer. Like there's different nuances to it, but essentially you have an internship and then you have to have an academic advisor and you have to create kind of like an educational piece to that internship. So on top of the work that you're doing, then you kind of had like either books or articles you read, and then maybe you write a paper. I ended up writing a blog post for our Habesha Health website. It's www.habeshahealth.org. If you want to go check it out, we have a lot of other blogs as well, from our speakers. And so I applied kind of application, they approved it. And then I did it like during our online virtual schooling because I really did not want to take another class online. So this was another way to kind of like gain the same kind of knowledge, or even more, I would say, than I would learn in a classroom and get those like practical skills.
Yeah, absolutely. That's awesome, and I'm glad that you were able to get credit for it for school as well. That is definitely something that is valuable.
Yeah.
Okay, so now shifting to the mouthful of a program name, the CDC CUPS Scholar with the University of Michigan Future Public Health Leaders Program.
Yeah, you could call it FLIP. That's what we call it.
FLIP. All right. Got you. Okay, so how did you find out about FLIP, and then how did you get into it?
Yeah, so I found out through like our fellowship director, Dr. Monica Cable. She has like a list of fellowships that we could apply to. So I made a meeting with her, and I was just like, I like didn't know at the time like what was out there, but then I saw that there was like a public health, because I had just declared. I think no, it was, yeah, I declared, and then I met with her, And I was going to actually apply last year, but I didn't end up applying. But thankfully I didn't, because that's when it got canceled and COVID happened. So this year I think what I wanted was like kind of a higher level experience other than kind of like community work, or, I like that the program was more education, but also like experiential. So the app, like I applied to the Michigan program, also the Columbia program, and there's a Kennedy Krieger with John Hopkins. So I kind of just applied in a way where I wanted to enhance my public health knowledge and take it to the next level. That was my goal when applying. And my a few mentors, and also Dr. Monica Cable, who's our fellowship advisor, she kind of guided me through the process. I really had a lot of doubts, and I had applied during like one of the hard times in my life where there was just a lot going on with COVID and like kind of fatigue, and I kind of just went for it. The application, like that, there's like 3-ish essays I think about for each, and they're like not that long, but they were very high level in the sense like I had to think deeply and kind of think about how I'm going to answer the questions creatively. And it kind of takes you, because it asks about like challenges or that sort of thing, so you kind of have to go back to those times where you don't want to remember, but it adds a lot to your like, personal development. And you realize, like I realized that while writing things. And so after that, I applied, had an interview, and it all worked out. And I mean, to be honest, like right now, like I did get waitlisted to this program at first, right? But a wait list is just kind of like a pause. It's not the end all be all, right? And so kind of I was like, okay, maybe it's not the right timing. And then I got accepted to the program, and the summer program it was like, I think an important part to my public health journey, because it did what I wanted it to. It took me to the next level, exposed me to new people, exposed me to peers. Because like I said, our public health program is not that big. So being able to like network with other people at different schools, larger institutions, smaller institutions, like that was an important part for me. And also had an internship. So I think it was worthwhile overall.
Yeah, and I definitely see you keeping those connections with the people from the CUPS program on LinkedIn, because I see when you comment on their posts and stuff like
Yeah,
that.
I actually met one of them in Puerto Rico this summer, which was like just like exciting. And there's just a lot of great people that I met, even virtually. And it was a virtual program, which is the difficult part of it. Navigating that was so hard. And we missed out on a lot of things that would have happened. But I mean, I'm still really thankful for the CDC and University of Michigan Public Health School.
Yeah. It's awesome. That definitely is an experience. Like if I knew about public health in my undergrad, that would definitely be like the type of experiences that I would try to get for myself. So I'm a little bit envious, But
yeah, definitely go ahead. And I went ahead. Like this is the first time I've actually applied to a program that's like really rigorous. Like I've always been shy or just kind of like doubting, like we always do. But this one, like, I mean, with the right support team and, like a strong kind of mindset, just go for it. If it's meant to be, it will be. And kind of like I went for me, the right timing, the right, time and the effort that I put in definitely worked out for the best.
Yeah, absolutely. So what kind of projects did you work on while you were there?
Yeah, so we had like kind of the educational side, like I said, and we had like our seminars Mondays and Fridays. And then those projects kind of consisted of like listening to guest speakers. We had exposure to like epi, biostats, like environmental health, like all the different parts of public health that I kind of had heard about in classes. But I think this was a different kind of perspective because we actually learned from the people doing the work, which was really important. I think the challenges that comes with it, the lessons that they learn, it's like different when you're learning about it in theory, and then when it actually plays out and people are actually doing the work. Like, we don't think about it like that all the time, especially when it comes to academia. But now that, people are actually doing the work, that happened. And then we had projects, we had to lead a discussion for our like program, and our group, like we had groups, and our group got climate change and public health. So that's one presentation that we had. The other one was a kind of a community health needs assessment, not in like the full blown assessment piece, but we had to kind of like, we had a persona that we had to take on, and we had to kind of guide them through a specific area in the Detroit metropolitan area, and look at like the hospitals that are available, the foods that are available, like other kind of elements pertaining to community health and the social determinants of health, and see kind of where are the gaps, where are the redundancies. And we actually had to make recommendations to Michigan Medicine, and they will use that. It's like their equity team, I believe. They will hopefully use that to inform the work that they do. So actually having a larger level impact, like I said, that was one of my goals. And then lastly, the internship. So we all had field placements, and my field placement site was at the Henry Ford Health System, which is one of the largest health systems in the Detroit area. And I, like Omari mentioned earlier, I worked on a maternal child health focus program where I looked at the lactation rooms and analyzed kind of like like what's out there, how much are available, what sites have it, what improvements can be put into place. And that definitely allowed me to like understand kind of like the policy level impact within a large health system.
Okay, yeah, that's awesome. And I know you also got to present that information that you got from like the lactation spaces at
Yeah.
a online something seminar for.
Yeah. Yeah, there was a CDC conference. Usually, if the program was in person, we would go to the CDC for, I think, a few days, and we would present that. We had to make posters of our field placement sites, and that's what Omari's mentioned are referring to. And so, kind of like a basic, like the research format, like the research poster format, and but we had to do it for our field placements, and it had different sections. So I got to participate in the CDC conference, the CDC director, and like a bunch of other well-known public health professionals were on that call. And just a lot of lessons learned. I think overall what I got, like one of the biggest things that I learned is that like just to trust the process, right? The timing, when the timing is right, it will happen. And that like experience over kind of like the stress and anxiety that we put on ourselves to figure things out right now. But I think in public health, experience is the most valuable, that will take you kind of like open new doors for you and guide you to what's meant for you in a way. Or like also just not knowing, like experience helps you know what you don't like, what you're not good, like the best at, right? And what you can improve on. So I think that was just the biggest lesson that I learned from all the well-known. I mean, the fact that I even got to get like at cdc.gov emails to network with, I think that was a really an impactful moment for me. And being on the same call as people that work at the CDC was definitely, I think, worthwhile.
Yeah, and it's also great to like have like this culminating moment of your experience where you feel like you've done all this work, you've presented it, you've given like recommendations, and now you get to share that with like a broader audience, which is always an awesome thing to do. And your poster looked awesome, by the way. I did get to check it out.
Yes, thank you for the help. Like Maury has been definitely like a big support system throughout this program, and the poster itself, he's definitely dropped a lot of gems and knowledge in editing. So thank you for that.
The help is only now getting started. We're doing some big things across the Hermela. Okay, awesome. And I wanted to ask you, like, you also said that there was some like mentorship or like professional development type things that you got to do. Like, if there were like any takeaways from that you wanted to share.
Yeah. So yeah, each of the groups that I discussed earlier, we had two mentors, and they kind of just like helped us understand like what are our common kind of challenges, right? And each person got to share like what are we like scared about, what are we unsure about, and we kind of each week like talked about those things. Like for example, like do I go to med school? Do I get an MD and PhD? Like that didn't really pertain to me, but some of the concerns that I brought up was the same things, like do I go get a job after graduation, or do I go straight to grad school, right? And I think this program helps solidify the fact that like I value experience, more than kind of education at this moment, right? And so realizing that just kind of eased a lot of my anxiety because I was just like going back and forth. Should I go to grad school right away? But the fact that I was able to kind of learn a lot from the internship that I had in it, what was like 8 weeks ish. So and I just like put myself in like a year from now, and I was like, yeah, I think a job is what's right for me. Being able to kind of gain that hands on, but also understanding how to work on a team, that was a major thing. Like even virtually working at the internship, there was a lot of challenging moments, right? Having a virtual intern is not easy, but navigating that and being able to advocate for myself, that was an important piece. And that's some of the concerns that I shared with our mentors, and they kind of helped me, you know, ease my worry, but also kind of be more realistic with what I'm capable of, reassurance, but also just like hearing that other students have the same concerns and fears and anxiety, like all these things, all these feelings that we're feeling, like it felt like we were in it together. And the fact that we were able to support one another, I was able to kind of like help others, they were able to help me. And that I think was the biggest thing for me.
Yeah, absolutely. Definitely having that community, and feeling like people are in the same place as you is always very helpful. And most of the time, people are. It's just that they're not willing to either ask that question or speak up.
Mm-hmm.
So
Exactly.
yeah,
Yeah.
definitely is that. Okay, before I ask you some tips, tips that you have for students, I know
Yeah.
that you're also a trained birth doula. So I don't think you've actively worked as one as yet. But why did you want this, and then what have you learned from it so far?
Yeah. So that's one of the things that I'm exploring. I think over the past 2-ish years, as I'm doing research in class, I actually did a research project on like Black maternal mortality in my one of my public health classes. I forget which one. And after that, I kind of just like learning at like a higher level. And like I've only been to kind of one birth in my life. It was my cousin giving birth. And, you know, being an immigrant adds another layer, kind of not knowing the language and not knowing the structures in place, being from another country. So like kind of going through that, I also had like a personal kind of relation to like my sister kind of has challenges because of like a maternal kind of defects, kind of challenges during pregnancy. And so it was very personal to me. And I got the opportunity to become a trained doula through the Patients Are Waiting Diversifying Doulas Initiative, which is a nonprofit in Lancaster. It was founded by an alumni from my school, actually. And their mission is to increase the amount of doulas, also address the maternal mortality, morbidity, and there wasn't that many. Now there's like 3 cohorts full of trained doulas that are exploring the birth work. And I kind of applied to that, shared my story, kind of my reasoning, what birth work means to me. I didn't really know much about it, but I had the bits and pieces that I researched, but also the personal experience that I had. And so learning about the inequities, learning about how much trust is put into doctors, learning about how vulnerable people like pregnant people are, birthing people, families are in this moment, and the fact that these are historically rooted injustices that are occurring, that just added another layer of just like it kind of like blew my mind how like, and then I took a race, ethnicity, and health class, learned a lot more about reproductive justice and all the, like I said, historical inequities. And then I trained to become a doula in February of this year. And that experience was, like I said, I think it was challenging because learning like such difficult things is hard, but also learning how to empower others, and learning the skills that are needed. And because of lack of access, even getting a doula is very expensive, right? So this organization is trying to, or they provide free doulas to birthing women of color, so Black and Brown people in the Lancaster, Pennsylvania area. And that was one of their missions, but also becoming a doula is really expensive. So being able to get the resources through this initiative has definitely, I'm really grateful for that, and has opened doors to kind of just like, although I'm not practicing right now, it's just been hard with school, navigating that. But I do hope to explore that post grad when I'm getting like my, or 2-3 years of gap year. We'll see where that takes me, but it's definitely a passion of mine. I just kind of have to explore which path in birth work is the right one for me, because there's a lot of politics to birth work, and there's a lot of nuances. There's a lot of challenges to becoming a doula. So I'm at the stage where I'm exploring and like listening and hearing and gathering different people's experiences, and hopefully I find out what that role is, even if it's not directly being a doula, whatever that may be.
Yeah, I think that goes back to like how you chose your kind of like track for your school. Like
Yeah.
you get experience in this and see if you like it or not. And thankfully there were those resources that made it like affordable and accessible for you to get that information. So that's awesome. And I look forward to seeing whatever you do with it or not do with it. But yeah.
Yes.
So what tips do you have for students? And I don't know, you like I asked a question that created a space for you to talk about what you wanted to talk about, and you were going to talk about gaining new public health experiences while in undergrad, which I feel like is a tip in itself for students. I don't know if you just want to talk about that.
Yeah, I mean, I have like a list that I kind of made, but
Do it.
I mean, first thing is just go for it, right? I mean, I know we all have that fear, that anxiety, but finding the support system and that network and the right mentor for you, I think is a key piece in navigating anything as an undergrad, but also going to grad school, like just moving on in life as you get older. There's a lot of things that other people have been through, that you probably are going to go through, being first gen, being an Ethiopian immigrant, being a woman on a predominantly white institution. Those identities add a lot of different challenges, and with those challenges there's pieces of wisdom that other people have to kind of make it easier for you. So being able to tap into those resources, I think that's one big thing for me. Like anything that's in front of me, I will use it and make the best of it, because there's other people that don't have those opportunities. And when I get an opportunity, I make sure to make just like to fully use that time and that experience, whether I learn something good, something bad, something that helps me, that doesn't help me, right? I think there's a silver lining and there's also a lesson to everything. Um, I guess the other thing, be your authentic self. That's a major piece, because there's a lot of things that are going to try to shape what you want, what you think, and just say no. I think that the last year I've learned, really just say like no, and that'll do it. If it doesn't align with what you want, doesn't align with your values. And I'm actually taking a designing your futures class right now. It's meant to kind of just help us understand who we are, what we want in the future. And Beth Throne, who's our professor, she said, I bring this up because it's just so important. It kind of was like, wow. It says, if you don't design your life, someone else will design it for you. So that's an important piece I would kind of just reiterate in her words, because I just heard that maybe like 2 days ago, and it's kind of brought this new perspective where like you have control over your life and the experiences and the people that you meet, and all of that kind of goes to kind of shape your life view and what you want to do. So that's another thing. And it's okay to not know what you like exactly, especially in public health. I have ideas. I like global health. I like maternal child health. We all have like these varying things, but I think with experience, with time, with trusting the process, with faith, like it all will work out and at the right timing. And I think, yeah, connect with people on LinkedIn. That's how I met Omari. And it's just like I connect with random people. Make sure you send like that short message to people, and just like be authentic and kind of make everything count, because you never know what's going to come about that relationship. I mean, networking, everyone says it's good. Like I'm going to echo that, but also just like don't fear what they're going to say, what they're going to think, because they probably were in your shoes like 2 days ago. So that's for like a big thing for me. Utilize again your resources that you have at hand and be grateful for it. And also just have fun. I think that's something I need to emphasize for myself more. It's an uphill battle, definitely, especially for us as like minorities. But I think, you know, at the end of the day, like we're here for a reason and we are going to make that because again, our goal should be to make that lasting impact on the world, to make it a better place and, solve the health problems, prevent all the diseases, and just like, make kind of public health, ensure that it's collaborative, work with others.
Yeah. Okay. Well, thank you for dropping all that knowledge. That was definitely very valuable, and I appreciate that a lot. And yeah, I echo a lot of what you're saying. Especially like trying to show up and be there and be intentional and try to shape your own life. And I think like a book that comes to mind is Essentialism by Greg McKeown. I'll link it in the show notes in the description as well. But it's really like just focusing on what is important in life, and because there's more with less, and really focusing on what drives you rather than like what drives other people, and you molding your life to them, as you said. And just like tangentially, once again, like if you're not on my newsletter email list, definitely do that. How Hermela and myself have connected more deeply is because I sent out an email saying that I was going to have this paid mentorship program. Hermela was the only one that reached out, and from those conversations, it just turned into like a free mentorship. And now we chat a lot, and that's not open to a lot of people. But she put herself in that position right now to have access to me, and I think like a lot of people are scared to put themselves into that position to get the access or the information or just get connected with someone more deeply. And I think that just goes to show all the great things that she is doing, from the CUPS program and the Doula and working with Habesha Health and going into a senior year and then going to kill it afterwards. And I'm definitely going to be here helping Hermela figure out her next steps afterwards. And so, yeah, I don't know, I'm kind of rambling.
No, you're good. Yeah, and just take risks. That's the other thing I would add. Like, also take initiative what's on your campus. If you're undergrad, if you're a graduate student, like I'm a peer health educator, and like I've learned a lot about our campus from a different side through that experience, advising students, just like sharing. Also, like once you know, share it, like pass it on to the next person, because not knowing is like your biggest enemy. But there's that tool out there, so just grab that and make the best of it in the moment that you have.
Yeah, absolutely. And one other thing I wanted to say is like with me looking at mentorships, like I don't want to be helping someone who isn't helping other people, because I think, as Hermela just shared, we all have knowledge of where we are right now, and we can pour back into the people that are looking up to us. And that's why me and Hermela resonate so much with each other. But that's neither here nor there. And yeah, okay. So like in the questions that I send out to you, that you fill out, you ask the question of what do you think makes students stand out as undergrads in public health entering the professional space? And I think this is a very timely question. I actually had a conversation with someone who graduated from their bachelor's degree this year, and they're having a really hard time finding a job. And that's specifically because COVID-19 hit while they switched into their public health major, and all the opportunities that they had got kind of canceled, which is tough for a lot of people. And that is probably what a lot of people are dealing with right now, especially like public health students within their bachelors trying to get jobs right now. And I think it's all the things that Hermela shared in this episode, is like reach out to people on LinkedIn, make those connections, get into those on those email lists, because I also send out job alerts. So all these different
Sign up.
Yeah. So just really thinking about how to expand your network and being intentional about it, having those conversations, using your university's directory and reaching out to students there, finding out what alumni are doing. And I think LinkedIn makes it so much easier because there's so many ways for you to find out that, okay, this person who went to the same school as me is working at this organization. Now I can reach out to them and speak about the school, and then wrap in, okay, how can I get into this organization? Are there any opportunities around there? So I think it's really about being proactive, because as we all know, public health has gotten to the forefront. The graduate school applications have gone up by like 20 to 30%. I think in some schools it went up like 80%.
Oh,
So
wow.
yeah, so it's a crazy world out there. So I think it's really just continuing to do the things to set yourself apart. And even if you're not able to find those like internships or other experiences, try to make them yourselves, whether that's independent projects, or saying that you're going to offer to do something, or like something that I thought of today was joining different task force or coalitions that are happening in your area, because that's also like, even just being a member of that is something that you can put down on your resume and speak to it. So there are just so many different ways to position yourself, but it is definitely going to be hard. I'm not gonna lie. Especially people looking into public health jobs right now. But if you are doing all the things that Hermela is doing, or like just putting yourself into the experiences and getting in front of these different people and building out your network, because you never know who's going to have that opportunity that's really going to resonate with you, or is going to come back in like 6 months or a year's time and say, oh, like, I think this is something that you might be a good fit for. So I think really just being intentional about making those connections and trying to make the most of what experiences are out there, and making those experiences that you may want to do but just aren't out there, because there are a lot of things that you can do in public health that you don't need like a formal institution to do it. Definitely it would be a lot more motivation if there was a formal institution, but if there isn't, I think you gotta find you can't let that be a barrier to you being successful in life. You gotta do what you gotta do.
Yeah.
Yeah.
Say that again.
Yeah, exactly. So I think it is all about being proactive, turning on job alerts, reaching out to people in your network, letting people know that you're open to opportunities, and what kind of things you're looking for. And like, as we said in this conversation, like, a lot of us don't know what we want to do in public health, because we don't know in public health, because there's just so much to know in public health. And I think that's fine. And I think just really delving in on those skill sets and those things that you can talk to in those job interviews are going to be very important. Yeah, so I think
You gotta start somewhere. You gotta start somewhere and build your way up. So I think that's once you get to that kind of starting point, you'll make it to the end, with perseverance and a lot of like determination and staying committed. There's obviously, it's going to be a kind of a crazy slope, but you kind of just use, like I said, use the tools that you have in front of you to kind of, bend it the right way, and make it worthwhile.
Yeah, absolutely. Making it worthwhile, and just using all the experiences and opportunities you have to the best of your ability to really stand out. I think is key, and something that we should all be trying to do. But yeah, that's my little advice there. If you have any questions, please feel free to DM me on Instagram, the PH Millennial. Make it a specific question, not a broad one. I get too many broad questions. Yeah, well, I really appreciate you taking time to come on, chat, and sharing a little bit about your public health journey so far. I know there's a lot more to come, a lot of great things to come, and I look forward to helping and supporting you get there. Where can people connect with you?
Yes, my LinkedIn, probably Omari will put it in whatever link down below. I guess that's the main way to connect more professionally. And I'm happy to kind of assist students, share some knowledge, answer any questions, but also be authentic, be vulnerable. I think that's oftentimes we don't talk about our challenges. We don't talk about our downfalls. We don't talk about those kind of like, I'm scared to say it type of things, but I think that's what makes the best lesson. And so I'm happy to be authentic and be real and just kind of help other students, also help, I would love to connect also with other public health professionals, as I will be on the job market soon. I hopefully able to explore what's out there and hopefully find the right match for an organization.
Yeah, definitely. Well, I will definitely link that in the show notes as well as in the description of this podcast or YouTube or wherever you're listening to. But thank you all so much for tuning in today and listening to Hermela's story. And I appreciate you all. Be sure to subscribe, to share this with a friend, to leave a like. If you want to support, you can go to buymeacoffee.com/the PH Millennial, or you can just follow me on Instagram. I appreciate that as well. Peace out.